face to face every day, and I want to protect myself, protect my coworkers, and protect the patients that I do see.
We all get vaccinated, we'd be better off. Not only important, I think it's essential that people do it. We're all in this together. Once you realize that, it found it a lot easier.
It's been really difficult lately. It's hard to teach with a mask on and not being able to project your voice. It's hard to not see the kids' expressions on their faces.
I want this needle to help me to live for a while more so I can enjoy my grandchildren and go big berries and go have fun.
I miss coming to the game. When it's time for me to get the shot, I'm gonna go sit down in the chair and close my eyes and tell them to stick me.
It's going to save not only my life, it's going to save lives of the people around me, the babies that I care for, my grandchildren, my parents. It will be so nice to not live with that fear.
Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe, and joining us virtually is Saskatchewan's Chief Medical Health Officer, Dr. Shahab, and the CEO of Saskatchewan Health Authority, Scott Livingstone. We will have opening remarks followed by time for questions.
Good afternoon, everyone, and thank you for joining us here today. 4 weeks ago, Dr. Shahab and I released Saskatchewan's reopening roadmap, which was a 3-step plan to gradually lift the public health orders and restrictions based on reaching significant levels of vaccinations. Since that time, we have reached the Step 1 threshold, and Step 1 actually began this last Sunday on May the 30th. We've now, since then, have reached the Step 2 threshold, and Step 2, as we know, will begin on Sunday, June the 20th. And we're getting very close to reaching the Step 3 threshold, which is 70% of all adults over the age of 18 receiving their first shot of vaccine, and that means that Step 3 could conceivably begin as early as July the 11th, provided that we do meet that Step 3 threshold or that Step 3 target prior to June the 20th, when Step 2 does begin. When we released the reopening roadmap on May the 4th, Step 3 was not quite fully developed. We said that most remaining restrictions would be lifted in Step 3, but event and gathering size limits, as well as the indoor masking order, would remain in place until further guidance was finalized. Today, we are able to provide that further guidance. So 3 weeks after 70% of all eligible Saskatchewan residents aged 12 and over have received their first shot of COVID-19 vaccine, and once at least 3 weeks have passed from the start of Step 2, which is on June the 20th, those last 2 public health orders, event and gathering size limits, as well as indoor masking policies, will be removed. So that could also happen conceivably then as early as July the 11th. If we meet our vaccination targets by June the 20th. It's really up to us, the people of Saskatchewan, and how many of us make the choice to protect ourselves, protect those around us, take the time to go out and get vaccinated. That is really what this is all about. The goal isn't to just meet some target number that has been provided. The goal is to protect Saskatchewan people and families so that we can reopen our communities and our opportunities safely. And the way to do that, in fact, the only way to do that, and to make sure that we can reopen safely, is for the vast majority of us to get vaccinated. We are confident that we can move forward with removing the remaining restrictions for 2 reasons. First, because vaccines are working. They are driving down case numbers, they're driving down hospitalization numbers here in Saskatchewan as well as across Canada and around the world in countries where we see high levels of vaccination access. And 2, because of these high vaccination targets that we have set, particularly the last one, 70% of age 12 and older with their first shot, we will be able to move forward with our plan. Today, we are at 62% of those 12 and over. In the U.S., in comparison, is at 60%. We've all seen the large crowds south of the border at hockey games, at golf tournaments. We see, I believe, Las Vegas is removing their restrictions today. And over the course of this past weekend, we saw large crowds also at the Indy 500. The U.S. has moved forward with their reopening plan much faster than we have here in Saskatchewan, and with lower vaccination rates. And their case numbers do continue to fall. Here we are taking a more cautious approach with a higher level of vaccinations required. There are just over 1 million people in Saskatchewan who are eligible to receive the COVID-19 vaccine. In fact, it's 1,033,000 to be exact. So that means just over 720,000 people would need to be vaccinated for us to reach that final target. That's a very significant level of vaccination, and it will provide our province with a very significant level of protection. I also want to say that even once the mask order is removed, everyone should still feel comfortable if they choose to wear a mask in certain situations as they see fit. If you want to keep wearing your mask until you received your second shot, that's fine, or when you're in the store, or when you're at work, that's all perfectly fine. Everyone should do precisely what they feel comfortable doing. I expect that we are going to see many people wearing masks for some period of time, but that will be their choice once the mask order is lifted here likely in July. We're not quite there yet, but we still do need about 75,000 people who haven't done so already to roll up their sleeves and to stick it to COVID in order for us to reach this final threshold. And then, of course, we will ask everyone to go back and get your second shot when it's your turn. So let's get this done, Saskatchewan. We've had the public health orders in place in this province for 445 days now. They could all be removed in just a little over a month if enough of us choose to go out and get vaccinated. It's up to each of us. It's up to all of us. This week, we started offering vaccinations in schools in more than 40 communities across Saskatchewan. And I think we are going to see, likewise, a very high uptake among students, just as we have seen in other age categories. Eligibility for 12 to 17-year-olds opened less than 2 weeks ago, and already we are 26% of that age group that has received their first shot. This is remarkable. That's before we even started making these vaccines available in the schools, as that just began this week. Nearly 2/3 of all Saskatchewan adults have now received their first shot, which is great, but that still leaves 1 in 3 of us who have not, for whatever the reason may be. So that is 66. So to the 66% of us who have gotten your first shot, I would say this: talk to your friends, talk to your family, tell them why you went out and got vaccinated, tell them why you got your first shot. Tell them that you got it to protect yourself, to protect your family, and to protect the loved ones that are around you. Tell them you got it so that we can get together safely with our family and friends. Tell them you got it so our kids could get back to playing ball and soccer. Or you got it so that we can all get back to cheering on our Rough Riders over at Mosaic Stadium. And so things can get back to the way they should be and used to be in Saskatchewan. As Premier, this is a message that I've been sharing for the past number of months, and I know my voice is loud, but it's only one voice. You only need to go to a Rider game to know that Saskatchewan's collective voice is much, much louder. We know the power of conversation on Coffee Row. We know the power of a conversation on a sunny patio at one of our great Saskatchewan restaurants, or in the stands at your kid's first ball game. So Saskatchewan, what I would ask is that you tell your family and your friends why you got vaccinated and why they should consider the same. That's how we are ultimately going to protect ourselves and our neighbors and our community. That's how we will hit the thresholds and reopen our province safely. And that's how we will get everything back to the way it should be and have a great Saskatchewan summer. Until then, let's all keep doing our part. Let's keep following the public health orders that are in place today. We're not quite there yet. However, we are well on our way. And let's keep getting vaccinated. Once again, I want to say thank you to all of those individuals that are working in our clinics and in our pharmacies, delivering vaccine shots each and every day. And I want to say thank you to the thousands of Saskatchewan residents who are doing their part in protecting not only themselves, but protecting those around them. And doing their part in ensuring that we are going to get Saskatchewan reopened by getting vaccinated. So let's go out over the course of the next number of days and weeks, and let's finish that job. Dr. Shahab?
Thank you, Premier. So I'll first of all begin by expressing my sympathy to the families and friends of the 13 Saskatchewan residents who passed away as a result of COVID-19 since our last briefing, May 25th. And then for today's announcement, I think it's part of a staged approach. We have already entered step one on Sunday. It has been gratifying to see that slowly, responsibly, in a thoughtful way, people are maybe meeting each other mostly outdoors in their back decks, for example, up to 10 people. Although you can also meet indoors. But it is important that we fully understand what still is required under step one and be careful and considerate as we move forward. And then also what is still required, including mask use in all indoor public places in step two. Plus, of course, continue to step up to get not only our first doses, and I really look forward for us to exceeding that target of 70% 12 and older, but also get our second doses. I've always said our seniors have shown us the way, great uptake, even 60 plus, improving uptake 50 plus, and we really need to follow that lead, chase that lead for first dose uptake, go as high as we can. And again, second doses are starting strong. We have, in terms of supply, May was a blockbuster month, and what a difference it made in terms of population level uptake. June, July, both are blockbuster months for vaccine supply. And so again, I think it remains critical that we step forward, not only for first doses if we haven't already, but also as soon as we become eligible based on either age or based on date of your first dose, get that second dose in a timely way. Because the quicker we move along that, the safer we all are to enable step three to start on time. And complying with, for the next 6 weeks, complying with public health measures that are relaxing as we reopen, but are still there at a minimum level, I think is also important, because as our vaccine protection increases, we still want to continue to see our case numbers coming down. And they are coming down to a remarkable extent, but that we should not right now become complacent, either on our public health measures that are currently still required, or in our interest in getting our first dose and completing our second dose. And I would also say that, there are parts of the province where our active case numbers are still a bit high, the northwest, north central part of the province, some areas in the south, and all that information is on our dashboard. And again, I would really encourage that we, be fully compliant with the public health measures over the next 6 weeks as part of step one and step two, and really increase our vaccine uptake. Our vaccine uptake does vary in different parts of the province. Is highest in Regina, I think, for age groups, but Regina also got a bit of a head start because of its high case numbers in March. But I think we all need to chase Regina's lead and have a higher vaccine uptake across all age groups throughout Saskatchewan. And I think that will really put us in a very strong position for step three, decreasing and ending all public health measures, and also, making sure that we have high rates of first dose and high rates of second dose will also put us in a very strong position for the fall, because I think one dose is good, two doses much better, and that will ensure that as fall comes after our great summer, we will remain protected and will keep COVID at bay. I'll also maybe just quickly mention that, as we had been discussing around AstraZeneca, it's really good that NACI did come out with the recommendations, which is aligned with what we had been thinking, for the last few weeks. So, I think the issue is resolved for those who received AstraZeneca first dose. They can choose to receive AstraZeneca as a second dose, and clinics will be starting next week, June 7th. And that will be, within the 12-week margin for those who got the AstraZeneca first in middle of March, and those are mostly people in Regina, I think, but then, obviously AstraZeneca second doses will be available to anyone in Saskatchewan who chooses to receive AstraZeneca as a second dose, and that information will be available on the SHA website over the next few days. And then, of course, if people choose to receive another vaccine like mRNA vaccine, Pfizer or Moderna, instead of a second dose AstraZeneca, NACI has published its guidance that you can choose to receive another vaccine instead of AstraZeneca second dose. Both are equally effective. Both are safe. With the second dose AstraZeneca, the risk of vaccine-induced thrombocytopenic thrombosis is much lower, and it's an informed decision. And AstraZeneca 2 doses has been studied extensively, for example, in the UK, where it was the bulk of the vaccination program. Is a very safe and effective 2-dose schedule to bring the rates down in the UK. But also there's increasing evidence now from the UK, many other countries in Europe, that for those who choose to receive Pfizer or Moderna as a second dose, again, the data currently showing that there may be some more local side effects, but certainly the immunogenicity studies are showing that the body mounts a good immune response with that second dose. Of course, we don't have the same efficacy and effectiveness data that we have with second dose AstraZeneca, but there's nothing to suggest that those would not be, good or as good. And of course, that will be closely monitored over the next few weeks and months. So I think that is good news. So basically now, it's all full steam ahead to complete your first doses and your second doses as quickly as they come. And this really, what we really hope to see by the second week of July, as the Premier said, is not just a high first dose uptake of 70% or higher, 12 and older, but a high second dose uptake as well. And, with the timelines that are already published, as long as the supply comes, we expect to see high uptake in people in their 50s and older, certainly for second dose, and clinics starting for people in their 40s as well. Thank you very much.
Thank you, Premier Moe and Dr. Shahab. We'll take questions now, and we can start in the room. Mark?
Was there any consideration given to holding off removing the mask mandate and the large gathering restrictions until more people have their second dose and timing it with second doses instead of first doses?
Yeah, I think the second dose strategy is actually part of what has enabled us to make this decision. As you know, we're well into our second dose strategy as we speak, as we continue to deliver first doses to those 12 to 17 in our school system, as well as all of those 18 and over. And we do have about 75,000 first doses that do need to be delivered in order for us to achieve all of the metrics to move forward with the full implementation of phase 3, which would include the removal of the mask mandate that we have in the public health order, as well as the limits on event and gathering sizes that we have. But if you look at where we are today, we're 70 and over with our second dose strategy, moving to 65 and over, I believe, in the next day or two with our second dose strategy. If you look out to July 11th, we'll be well into making those second doses available to Saskatchewan people by that point in time. Well over half of Saskatchewan people will be eligible to receive their second dose by that point in time. But I would just say this, the strategy will work, both first and second dose with respect to the dates that we ultimately have here. But we have a little ways to go in our first dose strategy, and I would encourage Saskatchewan people, those that have been vaccinated, to talk about this wherever they are, whether it's at their child's ball game, whether it's at Coffee Row, whether it's in conversations they're having with their friends, to talk about the reasons why that you chose to receive your vaccine, so that others most certainly will step forward and also make that same choice, so that we can move forward not only in reopening our communities, of which we are going to do, but move forward and ensure that more people, if not virtually everyone in our communities, is safe. The risk as we move forward for an unvaccinated person, I think Dr. Shahab might add to this, but the risk as we move forward in reopening our communities to someone that has chosen not to be vaccinated is the very same today as it was 445 days ago at the beginning of this pandemic. That's a very different and lower risk for all of those that have chosen to receive a vaccine. Dr. Shahab, I know you might have something to add to that.
Yeah, no, I think I don't have too much to add, but obviously, we have been through many challenges over the last 14 months. Over the summer last year, as we reopened, our case numbers remained very low, but we did see intense outbreaks in the northwest and in small communities in the south. At that time, there was no vaccine, and it was the original strain. It wasn't variants of concern. And then, of course, we saw, significant challenges in March with variants of concern, which were more transmissible. But by that time, vaccines had already started, 2 doses in long-term care. And we were really thrilled to see how well they worked, even in frail elderly, in protecting against hospitalization and deaths. So I think, with all that information, with our low number of breakthrough cases, I think we are increasingly confident that as long as we can keep our case numbers low, comply with our public health measures for the next 6 weeks, as part of step 1 and step 2, and of course go as high as we can in our first dose and then second dose. I think the outlook looks really good. And of course, if we see clusters or issues either over the summer or in the fall, we always have to respond to them based on what the issue is and what the mitigating strategies are at that time. And in some cases, it may require that it happens because there's low vaccination rate in a specific geography or community. And at that time, we would have to then, really offer vaccinations at that time. But, we really should minimize the risk of that happening. We should really look forward to uniformly high coverage throughout Saskatchewan, because that will be our best defense starting mid-July in terms of really going back to a more kind of normal summer and hopefully a more normal fall. Thank you.
Follow up, Mark.
Yes, is there a timeline yet for when children under 12 may be eligible to receive the vaccine? And what advice would you give to parents of children under the age of 12 who aren't eligible yet and might be concerned as things start to open up?
Dr. Shahab, any input on that?
I think that's an excellent point. So first of all, we already know that children under 11 and under are not independently mobile. So obviously, if the vaccination rate is high in parents and families and friends, that indirectly protects children under 11. And similarly in schools, what we have seen is that with the school reopening plan, high case numbers in the community meant high cases imported into schools, but the transmission rate in schools was always lower than the community and never the other way around. And so looking at the fall, what we hope to see is high vaccination rate in staff and teachers in schools, high vaccination rate in operators of daycares, high vaccination rate in parents of children 11 and under. There will already be a strong ring of protection to enable a more normal start to the fall school year. But of course, we also expect and hope that there will be approval of vaccines So adding a COVID vaccine to that program would not be an issue. Thank you.
We'll take another question in the room. Adam?
For Dr. Shahab, what's the advice to people who are eligible for AstraZeneca for a second dose and maybe have to wait to that 12-week mark? They maybe got it later than next week. Is it best to go get protected? What do you say to them? Because they'll be making that decision, I think, tonight, because some of them will be eligible tomorrow to get the Pfizer shot.
So I think on the one hand, there's clarity now about options, and all these options are open. And we know that certainly in Regina, AstraZeneca was offered initially to healthcare providers, I think 14th of March, who were even younger than 40. And then it was offered initially to people in the 64 to 65 age group, and then I think 55 to 65. And then very quickly over the end of March, early April, there were many AstraZeneca clinics in Saskatoon, other parts of the province, and all vaccines played a critical role during that time to decrease our case numbers. Now for second doses, again, the optimum protection is at 12 weeks, but any time after 8 weeks, people can choose to get the vaccine. If they want to wait till 12 weeks, that's optimum, but if they want a second dose AstraZeneca, they can get it at any time after 8 weeks. So starting 7 June, most people will be eligible at that 12-week period, and they will be eligible based on their age or date of administration. But I would recommend that people still look at their eligibility on either of those two categories, and if they choose to get AstraZeneca, that should be widely available, and the details will be announced over the next day or two in terms of which clinics in the province are offering AstraZeneca and when. And of course, if people opt not to get AstraZeneca or it's not easily available near the community, again, there's a perfectly safe and effective alternates, which is either Pfizer or Moderna. And so I think it makes completion of the second dose schedule, irrespective of what your first dose was, very easy in Saskatchewan. And I think that's the main point. I think now, we had a remarkable month in May that really changed our uptake profile in Saskatchewan, and we really want to see the same in June and July.
Follow up, Adam?
What's being done to get to the 75 or so thousand people to get to that 70% mark or even get over that? As Dr. Shahab said, there are some communities that are under vaccinated. There are probably age groups maybe that are missing. What's the government doing proactively other than what it's doing right now to try and get those? Are we thinking about pop-up clinics, incentives? What can be done to get more people vaccinated with the first dose?
So there's a number of things, and Scott, you might add a few things in here, but I'll just mention a number of things off the top of my head. But first and foremost, you've seen you've seen a significant education effort through the media that the government and the Saskatchewan Health Authority have undertaken in informing people about the importance of getting vaccinated and what it can do not only for your own protection but for protection of those around you, as well as the opportunities for us to have these conversations about reopening our communities and our ability to do the things that we considered so very normal 446 days ago. We've participated in some correspondence across the province, reaching out to all Saskatchewan people to remind them of the importance to get vaccinated and to ask those that have not yet been vaccinated for whatever reason. And we understand many are busy and just haven't been able to find the time. We'd ask them to find the time sooner rather than later, as their protection would then begin sooner rather than later. When you look at the accessibility of vaccines being provided in Saskatchewan, we had very early in our vaccine campaign singled out different geographies in the province, of starting in the very far north, in our northern communities, getting those vaccines into those communities in the early days of our vaccination effort. We pulled that south into some areas that had some higher infection rates in the northern area of the province. Then quickly, and this ties into our AstraZeneca conversation, quickly allocated a number of additional doses that we had into the Regina area, ultimately down into the south central, southeast areas, as we encountered variants of concern in the province. So we have made vaccines eligible by geography as infection rates have determined. We've had mobile clinics that have operated in various capacities over the course of the last number of months, from visiting homeless shelters, visiting our group homes, moving on now into our schools. I believe we're operating in 40 schools as we speak this week, offering vaccines to those 12 to 17 years of age. And I think as we look forward into later in June into July, there may be some additional opportunities for even those mobile clinics to provide some targeted pop-up service, targeted on-site service in various capacities, as they have throughout. This is in addition to the multitude of efforts that we have had to continue with large amounts of vaccine being offered to Saskatchewan people as in as many communities as possible, and that's through our SHA appointment system, ultimately through the drive-thrus that we have seen, as well as walk-throughs in many communities as well, walk-through clinics, and then obviously our pharmacies coming on board and delivering vaccines as more recently. So, a number of different efforts have been put in place to address the volume of vaccines that we can deliver in as quick a fashion as we can, but also the convenience of receiving that vaccine. And as we look ahead at the percentage numbers that we have in our vaccination effort, they're high. We're ahead of the USA as we speak, and looking to go higher over the course of the next number of weeks so that we can achieve these metrics and move forward. But in saying that, there's always more work to do, and we're always adapting the vaccination effort as we move along. If you look back to the very first few days or weeks of our vaccination effort, and I can't remember whose article it was in the media, but it was being described as sluggish. We had quickly recalculated and looked at what is working and looked at what is not working and made the necessary adjustments. And I think to date we've had a very successful vaccination effort, and that we continue to look at it with that lens. What is working? Let's continue doing that. And what is not working, let's shift some of those resources into what is actually working. So, Scott, anything you'd have to add on any initiatives you see on the horizon from the Saskatchewan Health Authority perspective on continuing to make vaccines accessible to as many people as possible, in particular for the first dose?
So I'm not sure I can add much more than you did already, Premier, but I certainly since the beginning of the immunization program, we have built it to be delivering vaccines across the province so in a way that's as convenient as possible for Saskatchewan residents and their families to get vaccinated. We will continue to do so, and you've talked about a lot of those things we've already done by expanding walk-in clinics, doing pop-up clinics, managing drive-thrus, readjusting doses where we see available doses not being taken up as quickly as we would have thought in some communities, and that's not because people were turning them down, but likely because they went into the larger centers to become vaccinated. We will continue to do that throughout. The other thing that I think is important, and there was a news article, I think, yesterday about the school program. Just like in long-term care and personal care homes, we leveraged our existing infrastructure to very quickly vaccinate individuals with extremely high uptake, and we hope to see the same in schools. And as we get through the school program in June, we will continue to offer a multitude of opportunities for people to be vaccinated, including pop-up clinics, try more education, and we will do a mop-up, quote-unquote, for those individuals that are still sitting on the fence. We know that the virus is still with us, regardless of whether people are getting infected or not, and the reason we're not seeing hospitalizations is because the vaccine is working, and we want to continue to build that momentum throughout the summer to get those individuals that haven't had the opportunity to become vaccinated or are still sitting on the fence. And we'll improve our education programs and try to expand availability as much as we can throughout the summer.
We'll take our next question on the line. Operator?
We have Phil Tank with the Star Phoenix.
Yes, thanks, Mr. Premier, Dr. Shahab, for taking my question. I wanted to follow up on a little bit on something more specific about the northern half of the province, where we know the eligible age is 50 for second doses, I believe. And their vaccination rates there lag far behind, the provincial average in other areas of the province. Is there anything specific you might think about there to encourage people to get vaccinated?
Scott or Dr. Shahab, any comments on that?
So maybe I'll start by with a few comments. And so obviously, I am in regular contact with my colleagues, medical health officers, both in Saskatchewan Health Authority, the Northern Population Health Unit, as well as Northern Intertribal Health Services and ISC. And again, there are some communities with very high vaccine uptake, and that's not unique to COVID. It's true for, childhood vaccines, flu vaccines. Some communities throughout the province in far north, south, have very high uptakes of all vaccines, including COVID vaccines. And some communities have a lower uptake, and so sometimes, there is a need, like the Premier said, for local leaders to also support vaccine programs and model kind of high uptake. Sometimes it's a matter of, I mentioned the 3 C's, that, confidence. So if, 10%, 15% are hesitant, we already saw from some surveys that 90% actually are willing to take a vaccine, but all of those 90%, if 20% still have some questions, talk to your pharmacist, talk to your public health professional, talk to your healthcare provider, because in many cases we've seen a simple discussion answers many questions, and then that increases your confidence to get a vaccine. We've talked about convenience, and like Scott said, you have more choices in larger urban centers, but we have seen traffic both ways. We have seen people coming from rural communities to a larger drive-through clinic or walk-in clinic in urban centers. We've seen traffic the other way around, people going to smaller rural areas if they find a quicker appointment there. That is all fine. So there's more convenience in some parts of the province, and if in other parts, sometimes it takes a bit of a time for the next clinic to happen. But obviously, like Scott said, there will be opportunities to improve the convenience. And the last thing I'll mention, and the Premier spoke to that, is complacency. I think many of us have busy lives, work, children, and we sometimes put it off that, okay, I'll get my first dose, but maybe next week. And I think we shouldn't put it off. We have 6 weeks to focus and finish to make us successfully reopen fully as part of step 3. So we shouldn't put things off. We need to find the time. You are allowed to go even during work hours. There's lots of options available. We must find the time for our first dose as much as we can, support each other to get to that appointment, and also then focus and finish with the second dose. Because again, from other jurisdictions, we saw that there's sometimes a bit of a lag in people not coming for the second doses. So we need to make sure that there's lots of supply coming. There's no age restriction now for first doses. Everyone 12 and older is eligible. The age range for second doses is coming down very quickly, 50 and older for the far north, and then 65 and older for the rest of the province, but moving very quickly. But we need to make sure that we are not complacent and go as soon as we are eligible. Thank you.
Scott, anything to add?
So the only thing I would add is that we continue to work with our partners, both in ISC, the Indigenous Services Canada, but also in the North, where we see local champions helping us promote vaccine and try to eliminate any hesitancy there may be in those communities. And again, further to the other point I made is trying to be as flexible as we can with our programming. As an example, with the school programming, as you always heard, where these school programs are going outside of school hours. And in many instances, particularly in those communities that have been mentioned, we're offering it to families, not just the school-age children, to try to bring more people in to have those conversations about the safety of the vaccine and address any concerns that they may have, and increase uptake throughout the rest of the summer.
I would just add to this as well, and I'll use the example of 3 weeks ago yesterday we had hit the phase 1 benchmark of 70% of those over 40. Today we're at about 77% of those over 40 that have been vaccinated. And so, as Dr. Shahab has always said, once you are eligible, you are always eligible. And we have seen a number of folks come in over the age of 40 even the course of the past 3 weeks when they've been eligible for quite a period of time. In fact, 40 to 50,000 folks have come in and received their vaccine in that age category over the course of the past 3 weeks, between the time we hit the benchmark for phase 1 and when we actually move forward with the reopening in phase 1. So, we would just ask, as we now have hit the benchmark for phase 2, are getting close to the benchmark ultimately for phase 3, and have now added in an additional metric for the removal of all of the public health orders that are in place, with a benchmark of 70% of everyone over the age of 12 to be vaccinated. That now is our time to make a difference in this province. Let's make our appointment. I know many people are busy and just maybe haven't been able to find the time, but now is our time to make that appointment. Ultimately, receive your first shot. Be counted in these numbers, make our community safer for not only you and your family, but for everyone around you, and ultimately move forward with getting things back to normal in this province.
Follow-up, Phil?
Yeah, I was, so in May there was like 56 COVID-19 outbreaks in the Saskatoon zone, including the areas around it, most of those in the city, compared to about 16 in Regina. That sort of suggests that there's a different level of spread in obviously the two big cities. I just wanted to get your reaction to your reopening plan, given that it seems that COVID is spreading at a different rate in Saskatoon than it is in Regina and other zones and communities in the province.
Yeah, I would make a comment, and Dr. Shahab, you may have a comment as well, but COVID is not going away. We're going to continue to have COVID outbreaks and COVID spread, far after we reopen this province. It is going to spread, yes, through some folks that have been vaccinated. Yes, they will get COVID. However, by and large, virtually all the time, they will be absent of severe outcomes due to COVID. Unfortunately, those that do not get vaccinated may not have quite the chance to ensure that they are not going to experience those severe outcomes from COVID. So as long as there is a segment of the population that chooses not to be vaccinated, they will have not only contract COVID, but they will have more severe outcomes, and we'll have people ultimately that may be in our hospitals due to COVID and due to whatever the reason is for them those individuals not being vaccinated. Thankfully, as we move forward, we have the vast majority of Saskatchewan people are choosing to get vaccinated. It's not to say that they may or may not be infected with COVID, but it is to say that vaccines do work when it comes to ensuring that they likely are not going to end up in hospital. They likely, most certainly, are not going to, die due to this virus. Vaccines are proven to be very effective around the world, even after one dose. And ultimately, we're going to be well into our second dose effort here and already into it in many cases. But by the middle to the end of July, well into our second dose effort in Saskatchewan, and have the opportunity to get back to normal in our communities. But COVID is going to be here, and there's going to continue to be outbreaks here and there. But we are going to reopen this province, and we are going to live with what remnants of this pandemic that will remain in Saskatchewan and likely across Canada and around the world. Dr. Shahab?
Add a few details. So, what we saw in Regina in March was very challenging because we were seeing small clusters in workplaces where, because of more transmissible variants. And so even though people are following the COVID protocols, mask use, other measures, you would see small clusters, 2 or 3 cases, but with the variants, instead of a third of the workplace affected with the original strain, we would see maybe 60% of the people impacted, and then 6 out of 10 people then means 6 households and secondary transmission, and then going to other workplaces. So Regina, of course, had to go under very strict public health measures, and then of course vaccinations also started picking up in April and especially in May. And with that, with the effort that people in Regina put in, public health staff with testing, case contact, so all these things will remain important going forward. Stay home, get tested if you have symptoms, irrespective of your vaccination status. Quick case contact investigation, they will remain important pillars. But we saw that with that, Regina case numbers did come down after lots of hard work and helped by vaccinations. And we, on the other hand, we did see that with the migration of variants to South Rural, Saskatoon, Northwest, and not just migration of the UK B117 variant, but also from the western border, more impact of the P1 variant. We have seen increased transmission. And again, it is critical that, exactly why over the next 6 weeks, we want people to still comply with all the measures in their workplaces, in schools, and even though there's more we can do in terms of retail, restaurants, gatherings, we still have to comply with the measures that are currently in place. And of course, quickly complete our first doses and second doses. And already qualitatively, we're seeing that now when you have an outbreak in a workplace that has more people vaccinated, the outbreaks are much smaller. And we already seen that, long-term care, we are gradually allowing more visitations, but still with some precautions. And thankfully, we're not seeing that much of an issue, but we still need to be cautious and careful. And again, as our gathering size has become large, obviously last year we saw many super spreader events, and then we've never had large gatherings ever since November. Now we are, able to have larger gatherings, initially outdoors, but starting with phase 2, 20th June, indoors as well. But again, till July 12th, there'll be some specific measures in place which we should comply with. And then as our vaccine uptake, first and second dose comes up, again, in many cases, how big an outbreak gets in a gathering in a workplace, in a household will be a function of what's the proportion of people vaccinated with 2 doses, or at least till they're waiting for the second dose with 1 dose. I think there'll be a simple inverse relationship for the most part, and that will be our reality going forwards.
We'll take another question on the line. Operator?
We have Laura Falmanoff with 650 CKOM.
Hello, thank you so much for taking my questions. If we could just go back to the masking for one moment. Premier Moe and Dr. Shahab, children under the age of 12 can't get vaccines, as mentioned earlier, but also those between the ages of from 12 and older won't even get a chance to have their second vaccine until likely late July. So why not just wait until that age group has a chance to get a second vaccination before we ditch the masks?
I would just a quick comment on that, and this is with respect to all of the public health measures that we have in place. And if you look at the efficacy of 1 dose in the vast majority of Saskatchewan people, it's proven to be effective, is proving to be effective, and has proven to be effective in many other jurisdictions around the world. The public health measures that have been in place have never been in place with the intent of being permanent. They have always been in place with the intent of keeping ourselves collectively as society in this province safe until such time that we can have vast access, broad-based access to vaccines, of which we are now entering that time here today. So we will have, by the time we get to July 11th, the vast majority, over 70% of all of those 12 years and over will have 1 vaccine. Many Saskatchewan residents, likely over half, will then be eligible for their second dose of the vaccine. And in the weeks following July 11th, we'll see the rest of Saskatchewan people, including those 12 and up, also be eligible for their second dose of vaccine. So, we are moving forward, as I said in my opening comments, much more cautiously than what we've seen in the United States to the south of us, for instance. And we've all seen, full hockey arenas, the Indy 500, as well as other events in the U.S., with even lower first dose rates than we are at here today, never mind where we will be at on July 11th when the masking order could ultimately and potentially be lifted should we achieve the 70% percentile of everyone over 12 receiving their first shot, never mind where we would be in our second dose strategy in the weeks following that. So Dr. Shahab, anything to add to that?
Yeah, I'd just like to add a few points on that. I think those are important points, and what we've learned actually is that over the last few months, especially from other countries with a 2-dose strategy like the US or a delayed second dose like the UK, is that once you are 2 weeks out from your second dose, you're obviously very well protected from getting ill, even with mild illness or severe illness, but also less likely to transmit. So secondary household transmission goes down dramatically. So I think that's one source of comfort in terms of a 2-dose does make you less likely to get exposed and also transmit. With 1 dose, breakthrough cases and serious illness is much less common than if you're unvaccinated, but you can still transmit. But at a population level, if the trend we are seeing now, with case numbers going down, obviously we can reach a stage like we were last spring and summer, where our overall community transmission is low enough and our vaccine 1 dose and 2 doses is high enough for us to safely contemplate no mandatory mask and no gathering limits. But having said that, I think if people have immune suppression or just feel more comfortable even after 2 doses, certainly I would encourage them to wear masks for the next little while. When we enter cough and cold season, now that we're more used to wearing masks, we must remember in the fall to get a flu shot. And people who just want to be extra careful in the fall, especially if our transmission rates are coming up in other parts of the world or in Canada, mask use is always an option. It's not mandatory, it's recommended. And obviously, I would prefer in a large gathering, anyone who's unvaccinated wears a mask, and people who have 2 doses don't have to. And that would be perfect, but we don't live in a perfect world, do we?
Follow up, Laura?
Yes, please, thank you. testing numbers in Saskatchewan have gone down significantly over the last few weeks. Sometimes only a few hundred people tested a day, up to maybe 1,500 or 2,000. Test positivity rates as well in places like Regina and Saskatchewan can still be up to 10% or 10, 11% sometimes. So are we missing cases with fewer tests being done now?
Scott, do you want to comment on that, or Dr. Shahab?
Yeah, that is also a really critical thing we will have to monitor. So on a positive note, and we can get some confirmation numbers, or Scott can add, Saskatchewan has led right from the beginning of last year in point-of-care testing. We deployed, point-of-care PCR testing in the Northwest, and now there's lots of point-of-care testing options that are being used in healthcare, in schools, maybe used in businesses. So there's an extra ease of getting your initial test, and if you're positive, obviously you need a confirmatory test, so that's one thing. But our lab testing system, it must remain robust. Countries that are successfully reopening with a delayed second dose strategy similar to ours, such as the UK, have extremely high testing rates. In the UK, anyone can get from the National Health Service a test that they can do at home, and then re-enter the information on a database. So I think, high testing rates, whether point of care, home-based, or lab-based, are going to be critical for the next months as long as there's a global pandemic. And then, of course, through lab-based testing, the ability to do whole genome sequencing, to constantly look out for other variants of interest or concern is going to be critical. And absolutely, if our testing numbers start falling below a certain level, the test positive comes up because only people who have severe illnesses get tested. So, and what that also means is that people with mild symptoms don't get tested and continue to transmit. Now, obviously, on a positive note, the more the people are vaccinated with 1 dose and then 2 doses, the less likely that's going to happen. But unfortunately, we know that people live in social networks, whether that's geographical, age, other relationships, which may be ethnocultural, faith-based, where pockets of unvaccinated people may socialize more with other pockets of unvaccinated people or undervaccinated. And I think that is going to be a real risk, the Achilles heel, where we may see quick surges of cases, even though we have high overall vaccination uptake. And in that case, we will have to respond just like we have had to in the past, with a quick mobilization of an outbreak response, isolation, contact tracing, and other measures, including offering broad vaccines to under-vaccinated communities. But again, I would really, and the Premier said it, I think, very eloquently, that, why should we have that risk? Why we are so privileged, one of the few countries in the world with abundant vaccines for everyone 12 and over. Why do we want to keep that risk, that weakness in our province open when we have easy access to safe and effective vaccines? Thank you.
Scott, anything to add to that?
Just only to follow up on what Dr. Shahab said, that we've never exceeded our ability to test with our PCR testing in Saskatoon and Regina and elsewhere in the province. But I do believe that we're seeing a little bit of a downturn because people are feeling good about the fact that we're seeing other types of indicators drop. But that doesn't take away from the importance of people continuing to get tested, not just those that have more severe symptoms, but even mild ones. We're through the spring now. We also think that because of the thousands and thousands of point-of-care tests, antigen tests that have been distributed throughout the province, that is also impacting our other testing rates. But it is important for folks to continue to do that, even though the other numbers, the effective reproductive number, the amount of hospitalizations, ICU admissions, number of infections per day are dropping, all positive signs. Our testing rate is always going to be important. It's there. We've never exceeded the capacity. And for those individuals out there that have even the mildest symptoms, it's important to get swabbed.
We'll come back to the room for an additional question. Mark? No? Adam?
Yeah, I was just going to ask, you look at your watch, I'll make it quick. Have you had any discussions with the Rough Riders of the CFL on, I know you mentioned yesterday, on gathering sizes? Obviously, this could change, this July 11th could change a lot of events that have already been canceled in the province. People planning weddings and things like that. how confident are you that there will be a full stadium? We keep mentioning the stadiums in the States. What can you tell us about that?
Well, I think relevant ministers have been in touch with their stakeholders across the province, whether it be the Minister of Government Relations with community leaders and rural municipal leaders across the province, and all of the different community events that are hosted throughout the summer with this information that we're announcing here today, and to open up lines of communication on if they have some questions around how an event may occur. Our Minister of Trade and Export has been in touch with a number of business leaders across the province as well, that also will have interest in a number of the announcements that we're moving forward here today, and with the removal of, ultimately potential removal of the public health orders as early as July the 11th if we hit those metrics. I know the Minister of Parks, Culture and Sport has also been in touch with many of the event organizers and community leaders as well from across the province with respect to clarifying, answering any questions around today's announcement, so that all of those that are involved, whether it be with large events in our communities across the province, or with sporting organizations such as the Saskatchewan Roughriders, of whom I've talked with Craig Reynolds as well, as to now they know what they have in front of them with respect to what the future may look like should we hit these metrics, which I expect we will, and I would ask Saskatchewan people to go and ensure that we ultimately do, so that we can have the opportunity to, I don't know if the stadium will be full in the early days. That will be up to ultimately in the case of the Saskatchewan Roughriders or any event, up to how they will gradually build the numbers that they can handle in the stadium, and the numbers ultimately that they can handle safely. And then, I think lastly, it was going to be up to Saskatchewan people on how comfortable they are, attending, for example, a Rough Rider game. Me for one, if I'm able to receive, my second dose, even prior to that, I'm going to, I have no problem attending a Rough Rider game, regardless of the number of people that are going to be in the stands. It's about time that we get out and beat the Blue Bombers. We always love to do that. But most certainly, I will be comfortable going there. But that being said, I'll probably carry a mask with me. And, I may put it on at various times throughout the game. And I think, in fairness, as we go through the next number of weeks leading into the middle of July, when we ultimately may be able to have these larger events, I may think differently then. But there's going to be a lot of change that is coming over the course of the next number of weeks. One of the changes I think that will be significant by its absence is for 445 days now, at various times throughout the week, myself, Dr. Shahab, Scott Livingston, the Minister of Health, has come out here and made various announcements as to how that impact how we live each and every day. When we get to July, in this province, that's not going to happen. We are then going to make our own choices as to how we conduct ourselves each and every day, whether or not we make the choice to go get vaccinated, whether or not we make the choice to go get our second shot, and I hope many do. And that's going to be a little different after more than a year of listening to government officials like ourselves, myself, Dr. Shahab, Scott Livingston, on what's safe to do and what may not be safe to do. All of that is gone now, and we conduct ourselves, with the same, I think really with the same personal responsibility that I've seen Saskatchewan people conduct themselves with throughout the course of the past year, but it's going to be each of us using our own judgment on, what we do each and every day and how we do it. So I look forward to much better days ahead. I look forward to ultimately attending a Saskatchewan Rough Rider game this summer as soon as we're able. In fact, I'm pretty sure we're scheduled, if I'm able, I'll be at the very first Rough Rider game to cheer on with many other Saskatchewan people, the greatest football team in the world.
That concludes today's update. Thank you.